So this lady is getting a central venous catheter removed out of her internal jugular, so let's talk about it. Hi, my name's Ashley. I'm an ICU nurse and I love teaching nurses ICU content and anything related to nursing. So this patient appears to have a double lumen central venous catheter, which is a fancy larger bore IV that goes intravenously down the internal jugular and lands in the SVC, which is the superior vena cava of the heart, aka the vein that is just right above the heart. Double lumen means there are two lumens that we can administer medications through. Central lines are placed for a lot of different reasons. Sometimes we need them on sicker patients because we need more access points. The patient may have been receiving some harsh or vesicant medications that would not be safe to go through an IV long term. We can also use these for blood draws. Typically, you will mostly see these in a critical care setting. However, you may see them on like your PCU floors, maybe your med-surg floors. You'll notice when the nurse or whoever is removing this line, they are waiting for that patient to take a deep breath and hold their breath. And that's because when we remove these lines, typically we want patients laying back pretty much all the way flat, and we remove them either on end expiration when the patient's blowing out their air, or we'll have patients take a deep breath in and hold it. And that is to reduce the chance of them getting an air embolism in that internal jugular that would go straight down to the heart. It is a rare complication, but we do all the things to make sure that that doesn't happen when that line is getting removed. As wonderful as central lines can be, especially if you're an ICU nurse, like we love our central lines, they do come with risks as well. The biggest risk would be infection. Anytime you have a device anywhere that's going into the body or coming out of the body, there's always that risk that the germs from the outside world can go into the patient's bloodstream. And this is a direct access into the patient's bloodstream directly down to the heart. There's also risks for bleeding, or if the patient were to unintentionally remove it, there are chances patients can get blood clots around the line as well. But typically, if we are using central lines appropriately and safely and doing all the proper techniques when we're administering medications or drawing blood from them, that reduces the chances of any of these complications happening greatly.